Cool, perfect. Thank you, Amy. All right, everybody, good evening. Welcome to our December meeting for the Equity and Public Safety Commission. Usually we start off, for those who don't know, with the reading of the land acknowledgement. And, oh no, wait, I think we need to do roll call first. Is that right? Okay. Amy?
Yep, okay, roll call. Chair Crystal Cancino,
Present.
Vice Chair Junio,
Present.
Commissioner Hobson Cord,
Present.
Commissioner Sanders,
Present.
Commissioner Delgadillo,
Present.
Commissioner Yee,
Present.
and Alan, it won't be able to make it tonight. Had something come up, and Chair already acknowledged all of our guest speakers, so it's a roll call.
Oh, perfect. Thank you, Amy. And I believe next up is a land acknowledgement.
I believe Sal volunteered to read the land acknowledgement.
Thank you, Sal.
Thank you. We want to acknowledge that we gather in San Mateo County on the traditional land of the Ohlone peoples, past and present, and honor with gratitude the land itself and the people who have stewarded it throughout the generations. We honor and respect the Ohlone people's long history here that reaches beyond European colonization. We honor and respect indigenous people who lived and continue to live upon this territory and whose practices and spiritualities are tied to the land and its other inhabitants today.
Thank you, Sal. All right. Next up, Amy.
I believe it's agenda review. The agenda for today, after public comment, is approving the minutes, presentations from Alameda County Behavioral Health Care Services Crisis System of Care. Then there's a recess. Then there's a presentation from the police chief on the violent intruder response in the city. We also have on the agenda to discuss a retreat for the commission, to discuss the requirement to appoint a chair and vice chair in the first meeting of 2023. And we also have on the agenda to approve the complaint form. However, Chair, I'd like to propose, if we don't get to that and don't complete that, maybe to push it to the retreat or to a further meeting. And then it's just the regular items, future agenda suggestions, items from staff, and adjournment.
Yeah, I'm definitely good with that. We could definitely move that. All right. So I think that brings us, do we need a motion for the approval of the minutes? Or, I'm sorry. We don't need the motion for the agenda change, right?
No, I don't think so.
Okay, cool.
We do have public comment on the agenda. I do see some other city staff. We have Assistant City Manager Sharon Reynolds and Assistant to the City Manager Christina Fernandez. I don't see anyone from the public. Is there anyone that would like to make public comment? You can click raise hand in Zoom if you would like to. Okay, yeah, I don't see any public comment.
All right, then I think we could move on to our matters for consideration. Approval of the minutes. I'm assuming everybody had gotten to look over the minutes from our last meeting. Is there a motion to approve the minutes? Anyone?
I approve. Stephen.
Thank you, Stephen. Second,
A second.
thank you, Carol. All right, Amy, roll call.
Commissioner Yi,
I'm sorry.
just a roll call vote to approve the minutes, to approve. Well,
Oh, I thought
you
it-
made the motion, yeah, but.
Oh, I'm sorry. Excuse me. I approve. Thank you.
Commissioner Delgadillo,
Approve.
Commissioner Sanders,
Approve.
Commissioner Hobson Cord,
Approve.
Commissioner, Vice Chair Hunyo,
Approve.
and Chair Cancino.
Approve.
Okay, passes. Thank you.
All right. And then I believe our next matter that we have on the agenda is presentation by Alameda County Behavioral Health. Thank you so much for being here. I think we have Stephanie and Yesenia, I believe. Is that right? Perfect.
Yes. Yes. Thank you for the opportunity to present on our mobile crisis teams in Alameda County, and I will take the lead on the presentation, and Yesenia is here to help support with any questions that come up. I have tons of slides. I promise I won't spend a lot of time on each slide, but we put it together so that you all will have it for future reference. So. All right, next slide. So we operate a variety of mobile crisis teams in Alameda County. Our mobile crisis team, well, let me backtrack. So our crisis services sits within the Office of the Medical Director in ACBH, and our oldest type of team is our 2 clinician model, which is our mobile crisis team. So it pairs 2 licensed clinicians. We have county vehicles, and we respond to a wide variety of mental health calls. All of our staff are licensed clinicians who can write 5150s or 5585s. That's the welfare and institution code related to the detainment of youth because of a mental health condition. And our goal is to provide diversion to a wide range of mental health services to avoid a 5150 if possible. And so these teams work throughout the county. So all of Alameda County, except for the city of Berkeley and Fremont, they have their own mobile crisis teams in those cities. And we're Monday through Friday, 8 a.m. to 6 p.m. And we can go to the next slide. We also have a mobile evaluation team, which pairs a clinician from ACBH with an officer in 2 cities currently, the city of Oakland and the city of Hayward. And so the officer drives an unmarked vehicle in Oakland, a marked vehicle, so a police car, a cruiser in Hayward. And we respond to any kind of mental health call. Most of the calls are generated through 911. These teams operate pretty much either Monday through Thursday or Monday through Friday, according to the officer's position. His shift. And the goal is the same as our 2 clinician model, to respond to any type of mental health or substance use disorder crisis, with the goal of diversion if we can divert to, away from hospitalization, but they can write 5150s and they can also transport if needed. Next slide. We also have a community assessment and transport team. So this team pairs a clinician with an EMT. We started this pilot in 2020 during the pandemic. It was a pilot to really test out just a different team configuration and to focus on simple medical assessments in the field and also mental health. And we wanted to focus on low acuity calls, lower acuity. So mobile crisis and MET really focus on any type of mental health calls. Our CAT teams really focus on people who are ambulatory, meaning that they can get in and out of a vehicle. They're somewhat cooperative, meaning that they are consenting to the care with the goal of diversion. That was the primary goal of the CAT program, was to reduce our 5150 rates in the county. And they can transport as well to a wide range of diversions. They're designated to write psychiatric holds if needed and can transport to a variety of dispositions. These teams operate 7 days a week from 7 a.m. to 11 p.m. and run county-wide. The pilot is supposed to sunset in June of next year, but we're looking for ongoing funding to support the program in the future. It really helped to reduce our 5150 rates and just added capacity of teams in the county. So between our MET program, our mobile crisis team, and our CAT team, we are operating on most weekdays about 10 mobile crisis teams to cover the county. And on the weekends, that number drops to 4. Next slide. To, having mobile crisis teams for so many years, like our 2-clinician model has been around since 1988, we noticed that we needed to kind of provide closure to those mobile crisis interventions, meaning what happens to a person once they have contact with one of our teams, when they go to the hospital, what happens afterwards. And so to complete our continuum of care, we started outreach and engagement teams. We're often asked about the inclusion of law enforcement in our mobile crisis teams. And so all of our teams can involve law enforcement. So MCT is at the discretion of those clinicians. They can respond to calls without law enforcement. Our MET team, 100% of those calls are with law enforcement because the team composition is a clinician and an officer. And then our CAT team, calls are generated through our 911 system. Oh, we left off of 1, not 911, it's 911. We'll have to correct that. Our 911 system, so officers respond first, they assess the situation, and then they can request CAT to respond in the field. And they can leave that CAT team with the consumer. They don't have to stay the whole time. So, our thing about, we want to be very transparent about these mental health calls. There are many calls that don't require law enforcement, but there are many that do. We've had situations where people were calm and went from 0 to 100 within a few minutes of an interaction. We've had people who started out, escalated and police responded. And then when our teams arrived, they're calmed down and the police can leave. So it really depends on what's going on with the call. We want to keep everyone safe. Sometimes there's been a crime has been committed, someone's been assaulted, there may be weapons involved, there may be a completed suicide or a serious attempt, a serious assault, violence, damage, those kind of things. But if police are needed, we can dispose the entire call without police law being involved. So what happens after a person is seen by a mobile crisis team? If they go to the hospital and they are not admitted, we have outreach and engagement teams that we're trying to engage those folks and connect them to care. If they are seen in the community and they don't need to go to the hospital, but they need to be linked to care or need some kind of outreach, we have 3 types of outreach and engagement teams that operate Monday through Friday from 8:30 a.m. to 5 p.m. Next slide. So we have Crisis Connect, post-crisis follow-up. They follow up with anyone that's seen by our mobile crisis teams and referred to these teams or goes to psych emergency. And the goal is to outreach to those individuals 24 to 72 hours after the crisis event. They can see people face-to-face to psych emergency. They can make phone calls. We tested out texting people, but that was not successful, surprisingly enough. Staff link consumers to a wide variety of community services, of course, mental health, housing services, shelters, primary care, substance use disorder treatment, and many other services. The goal is to encourage voluntary services and to prevent a subsequent crisis. So that's post-crisis follow-up. Next slide. Then we have familiar faces. This is for our high utilizers. These are people who have frequent contacts with law enforcement, our mobile crisis teams, or present on their own or are regularly sent to psych emergency. And the goal is to reduce the use of acute services when they are needed and for folks to agree to voluntary care. So of course, we're trying to refer them to the same services: mental health, housing, primary care, SUD, applying for benefits. A lot of folks don't even know that they qualify for Medi-Cal, helping them to apply for Medi-Cal and things like that. So the goal is to encourage the use of voluntary services, prevent subsequent crisis, and reduce recidivism. Next slide. Then we have our community connections team, which focuses on our homeless population, or people who are insecurely housed, with the same goals. So this team goes out with our healthcare for the homeless team, outreach teams. And so where healthcare for the homeless would focus on physical health, we focus on mental health and SUD and connecting those folks to services. So they go everywhere in the community. Next slide. Then we have our geriatric assessment and response team called GART. This is an outreach and engagement team for individuals 55 and older. People always ask us, why is it 55? I'm 50 years old. I'll be 51 this month, actually. And so thinking about, in 4 years, I could qualify for the geriatric team is, surprising. But what we know about folks who have severe and persistent mental illness, they're often functioning at a much older level. They actually, many get ill and die 20 plus years sooner than the general population. So that's why we lowered the age to 55. And the goal is to, get those folks who are falling through the cracks, who may show up at an emergency room or have frequent contacts with law enforcement, or are referred through APS or a variety of providers. And we provide, age appropriate referrals to age appropriate community services. And we want to link those folks to mental health care, but also primary care, make sure their benefits are together. Some are, losing housing or need in-home support and those things. So we really try to support our seniors and connect them to long-term care. Next slide. And then the city of Alameda is operating a mobile crisis team that we supported by designating their paramedics. So this pairs paramedics are in the field, 2 of them, and they use telehealth through a community-based organization for the clinicians. And this team operates 24/7. So this is a wonderful pilot. It just started this year. Anyone can refer, and if they call 911 and it's a mental health call that doesn't require law enforcement involvement, they're just rerouted to this care team, and they reach a disposition. If the paramedics feel like they need to write a 5150, they need to consult with a licensed clinician through the CBO. They use telehealth, and they can write the hold and transport to a LPS designated facility. So that's the care team. And I put the numbers for these teams that are operated through the cities, because you could reach out to them and get more information as well. So that is the care team through Alameda. Next slide. And then the city of Oakland is running, operating a team called Macro. So it is Mobile Assistance Community Responders of Oakland. And this team actually focuses on quality of life calls. That's what they call them. So it could be, a conflict in the neighborhood. It could be a recent crisis event, like a shooting or something like that, where you're responding after the fact. They do a lot of outreach to homeless individuals or people just having a hard time in the community. And it's comprised of Oakland Fire Department paramedics, EMTs, and a civilian responder. So these are people who are trained, but they're not licensed clinicians. And they're operating 7 days a week, 7 a.m. to 11 p.m., just in the city of Oakland. Next slide. BART also has a, we call them a mobile crisis team, but they are operating in and around BART. So on the trains and the BART stations, and they're responding to a wide range of quality of life issues that impact BART. So they want to create, visibility. They want to help folks who are having a hard time, but they also want to create an environment where people feel welcome to take public transportation. So there are many ways to access those teams, but they are on the trains and at the BART stations, and they're open during BART operating hours. And these are civilian providers, although they work closely with BART PD. Next slide. And the city of Hayward has a, they call it Mihu Heart. And the way I describe it is that it is pre and post crisis support. And we operate a MET team in the middle of that. So they may get a referral for someone before there's a crisis, there's some kind of escalating situation. If they can't resolve the crisis, they could have our MET program that pairs a clinician and an officer go out. And then after the fact, they will follow up with that person. So this is a City of Hayward program. It's operated through the Hayward Fire Department in collaboration with ACBH and the police department. Next slide. All right, so it was a lot of slides and a lot of information. So I am open to any questions you all may have.
And through the chair, if you don't mind, I apologize. I should have given more of an introduction at the beginning. At the last meeting, we heard from the mental health clinician, Mika, in South San Francisco, and city leadership has asked for you all to help decide how to expand that program, whether to expand the program and what would it look like to expand it. Currently, she works like a 9-to-5 schedule, isn't there in the weekends or the evenings, and she's the only one. So do we want another clinician? Do we want to serve 24/7? Leadership asked to bring in some experts from other locations to share some best practices. So that's why we invited Alameda County to come out. I feel like there was so many interesting models and so much information. You all have that in your packet if you want to continue digesting too. If through the chair, if you don't mind, I actually have a question. I've been wondering about these teams. It's just the main few teams that you started out with. How do you determine, are they all from 911 calls, or do the 911 calls go to different pathways? Like, how do you decide which team shows up?
So, it's interesting when we talk about these mobile crisis teams. For most of the time that I have been working for ACBH, we only had the 2-clinician model. And it was only operating primarily in what we call North County, which was Oakland, the city of Emeryville, the city of Alameda. And so those calls were generated 2 ways. People could call our clinic directly or through 911. In the city of Oakland, we carry police radios and we're dispatched that way. Over the years, we've added additional teams, and at times it's confusing. So there are many portals. People can call our access line. We get direct referrals from crisis support services. So the 24-hour crisis line, which is also 988, right? So we can get warm handoffs or referrals through that. 911, people calling us directly. And when I say people calling us directly, it could be providers, it could be citizens, business owners. And so there are many ways to access our teams.
I've a question about that. It seems like there's a lot of different programs. How many people are actually on your team?
So, Yesenia, how many staff do we have at Crisis Services? How many clinicians? I think it's like 12 now, right?
So we have 8 clinicians that are licensed on our mobile crisis teams and 3 fully licensed clinicians on our outreach teams. And then we have peer specialists, or what we call mental health specialists as well. And we've recently added capacity by starting an internship program. We have 5 first-year interns, and we are preparing to bring on second-year interns as of January.
Yeah.
First year interns as far as like master's level, is that right?
Mhm.
Okay.
Yeah.
And you guys have any like psychologists at all? Or
We
any
do not
postdocs?
have psychologists. We only have master's level licensed clinicians. We also do have a registered nurse position, but we have not hired on to that yet.
Got it. Okay.
Yeah.
So you guys definitely have like a diverse discipline going on.
Yeah,
Mhm.
we're definitely a multidisciplinary team.
Yeah.
Yeah. And
so
to
with-
answer
sorry,
To
go
answer
ahead,
the
go ahead.
question real quick, I'm sorry about which teams. Pretty much, it depends on the way in which you access the team, what city you're in, and what's being reported. And so what I tell the general community is just call and ask for a mental health team. Who's ever available, depending on what's going on in what city, that's the team you're going to get. People can't call and say, I want a MET team, or I want the mobile crisis team, or I want a CAT team. They're pretty much just asking for a mental health unit.
And so are you guys stationed in one area, or are you guys all in different areas around the county?
You want to take that, Yesenia?
Yeah, so we have what we call our headquarters, which is stationed in Hayward. All of our calls that come into our program come in through that phone number, and the clinician actually sits in our Hayward office. But then our multiple teams, we have a South County mobile crisis team, which is the 2 clinician model, who is based out of Hayward, and they respond to anything east of San Leandro. And then we have the Hayward Met, who basically that team sits in the Hayward Police Department. And then we have the North County Mobile Crisis Team, which is the 2 clinician model, and they sit in North County in Oakland, off of our administrative building for the county. And then we have the Oakland Met team, and that clinician is out of East Oakland, but they're primarily in the police vehicle with the officer.
Mhm. And so if you're thinking about starting teams, it sounds like you have one team. What we did was we started from one location where most of our mental health calls were generated from, and that was in downtown Oakland initially. And then we expanded beyond that. And so if you're thinking about starting one, you want to look at some data, either police data or crisis support data or hospitalization data, like the zip codes of where people are coming from. That's probably where you want to start.
Thank you, Stephanie. Yeah, we're definitely trying to look at least like South San Francisco specifically for now, since I think there's 4 cities in the county that this was piloted, which was South San Francisco, Daly City, Redwood City, and San Mateo. And I think right now we only have the opportunity, right? Correct me if I'm wrong, Amy and Chief Scott Campbell, but we only have the opportunity to figure out and build and have to expand in South San Francisco for now. And hopefully maybe that can be a pilot for the rest of the county. I think I'm definitely hopeful for that, but yeah, thank you so much. I think somebody else has questions. I have a lot of questions, but I think Steven has his hand up.
Yeah, thank you. And to Amy, thanks for opening it up. Clearly, with all the different resources, and thank you, by the way, for being here tonight, for both of you. Really appreciate this. With all the different resources and the process to triage, prioritize, et cetera, systems-wise, what's not working? What do you find is not working with the systems that you have existing, that or you're foreseeing is going to get potentially worse?
Yeah. I think that one of the things we used to say about Alameda County for many years was that we had the highest 5150 rate in California. I don't know if we still do, but I think that when we started our mobile crisis teams, it was in response initially to help law enforcement with mental health calls in the city of Oakland, because they were responding to all of them. So we started a program and we started responding to those. What we noted was that as we build our mobile crisis teams, as you have more people in the community who are on scene assessing folks, you also have to have places for people to go. And so for a while, it was jail, leave them at home, or the hospital. And so what we found was that you also have to build diversion opportunities. So crisis stabilization units, more voluntary services. We need more of those. We also need more sobering and detox centers in the county. Right now we have one. And so that's not working. Also, our transports, we can transport in our county vehicles, but for people who need restraints, who are, intoxicated or just not safe to transport, they're transported via ambulance. And there are times when we have no available basic life support ambulances in our county. So, ALS transports like heart attacks and strokes, right? Or trauma victims. BLS is basic life support, like, you broke your ankle and you need to go to the hospital, or you have a high fever, or you're a mental health, a 5150 or 5585. And there are times where we are waiting on transports hours. And so, if a person starts off escalated and then you de-escalate them, and then you determine that they fit the criteria for 5150, and then you wait a few more hours, it could go either way, right? The person could be like, I'm done, get out of my house, or the person can escalate, and then we have to involve law enforcement and other things. So I would say that that's not necessarily working for us. Our ambulance providers are contracted through our EMS system, right? So we use Falck. We used to use AMR, we used to use Paramedics Plus, and now Falck. And so we've been having some difficulties with that. I would say the other thing is, since all of the issues with involving law enforcement over the last, we've been involving law enforcement since the beginning, right? But all of the media coverage regarding various things that have happened, whether they involved a mental health case or not, has impacted our work with law enforcement. We have, done well to develop rapport. We do trainings for law enforcement. They do trainings for us. There's a lot of cross collaboration and just, good feeling in terms of them protecting us and us, helping them in the field. But when the George Floyd thing happened, the Ahmaud Arbery thing happened, then we started having particular law enforcement agencies that didn't want to be involved at all. And so they were just backing off because they didn't want to be involved in a case where they might have to use force. And we understood that, but we had to do a lot of meetings and education and training around how do we work with law enforcement in this new era, right? And so there's a huge spotlight on mobile crisis teams, the use of law enforcement, and what we're doing with people when they're experiencing a crisis. And sometimes that hinders our ability to effectively meet people where they are in the community. So that's been a challenge for sure. Staffing is an enormous challenge. I think we have, just for our mobile team units, 12 vacant funded positions that have been vacant for 3-4 years now. 4 years. Years. And we pay really well. I mean, I think some counties pay more than us, but we pay pretty good. But we're all fighting for the same clinicians, right? We're fighting Kaiser, private practice, other counties, law enforcement agencies, hospitals. It's just not enough licensed clinicians who are interested in this work. Working in the field during a pandemic, seeing people face to face, evaluating, people for hospitalizations. Not everybody's cut out for the work. So that has been a challenge as well.
Ms. Stephanie, I want to tell you, we have 18 positions. I work for San Francisco Crisis Services.
Mm-hmm.
We have 18 positions that haven't been filled for years.
Yeah.
And we have a team of 40.
Wow. Yeah. Mm-hmm. Yeah. So that has been difficult.
I'm definitely hearing you. We have that same issue. ever since, you know, the events of 2020 that had happened, when people need to be put on a hold and they're in their home, right? Because you're there assessing them in their home because their families, you know, definitely needing help, but then they're refusing to go with you on the hold, and then law enforcement not being able to come into the home and actually pull them out of the home, and that actually escalating to now a barricaded subject,
Mhm.
right? Like it goes from 0 to 60 really fast when all we really need is somebody who's able to go into the home and remove this person from the
Mhm.
home. How have you guys figured that out yet? Because we've noticed that it's only the fire department that's willing to go into the homes to help us get these individuals who are on a 5150 or a 5585 hold. How are you guys doing that in Alameda?
Yeah, you know, it's interesting. It depends on which law enforcement agency. So we have better luck with Oakland Police Department because we have such a long relationship with them. There have been some other cities where we've had to walk away from so many calls and had to discontinue our service in that city because the relationship with particular law enforcement agencies was so contentious. And so we had to spend some time reading the bill. Is I think it's Assembly Bill 392 that's related to the use of force. And so what we had to understand as clinicians where the police were coming from, because my idea of use of force is everything from your voice, your presence, your uniform, your car being parked on someone's block, all the way to knocking on the door, forcing entry, extracting a person, putting them on a gurney, send them to the hospital, right? All of those are considered use of force. But when we were calling for law enforcement to assist, they thought, I mean, we literally had officers say, we don't want to show up and shoot the person. We would say, we're not asking you to show up and shoot the person. We're asking you to show up and assist us in removing this person from their house and getting them on a gurney. And so we had to have meetings with the brass, so upper, supervisors, management, things like that. We actually, in Hayward, the city of Hayward, our MET program was born out of this contentious relationship when we first tried to expand our services into the city of Hayward. And what we were able to do was come to the table and determine that the best model was the MET model. We needed to put clinicians in the cars with officers, develop those relationships, get officers who were interested in mental health, because not every police officer got into the work to do the full range, right? They're really focused on crime and chasing people down, and there's a need for that, right? But there are some officers who just were not interested in dealing with the mental health calls. So if they could say, no crimes being committed, I'm not getting involved, and they would say, call us back later, But we were able to get officers who, because of personal experience or just interest or their education, some of them, studied psychology in school, they got interested in it. And it was like, I'll volunteer for that particular team. And that's how we were able to build rapport. We also have a crisis intervention training that we offer law enforcement. It's a collaboration between ACBH and the Oakland Police Department. And we invite all of the law enforcement agencies throughout the county, and sometimes throughout the Bay Area. We have officers that come from outside of the county. And I think that helps to develop rapport as well with law enforcement. But we had to have some serious conversations about our roles in the community and what our expectations of law enforcement was and their expectations of us, because there are calls when we both agree it's safer to walk away and try it another day. The difficulty was the gravely disabled, 90-pound manic woman who, hadn't eaten in weeks, looked like she was going to fall over, was threatening her family, and literally all the officers needed to do was to put their hand on her shoulder and walk her out the door. They didn't want to do that. And we were scared that the person was so underweight and so manic that, they were going to die from starvation. The family was on scene, just this whole case, and we had to walk away. We also had other cases where us showing up and not being able to intervene actually escalated the person. So each time we went out, the person was more and more paranoid about us coming to the house. And so when we started, and Yesenia and I were making those phone calls, like, we need to do something because this is making it worse. So what can we do? So sometimes you have to involve a supervisor, a watch commander, talk to the captain or lieutenant to say, you know, you've been out there a few times, this situation is escalating. How can we work together? That's pretty much what it is. Do you have anything to add? Yeah, Yesenia.
Yeah, I was going to add, one of the things that really helped too is we did lineups. So whenever we have issues with any law enforcement agency or jurisdiction where they are not familiar with us or we're not familiar with their different officers, we will make an effort to do lineups. And we do lineups in a way that we're going to hit all of the different schedules
Shifts.
that, the shifts that are going to interlap with the times where we're available to go. So, you know, there are times where we'll go to a 6 a.m. lineup, even though we're not on duty, because those officers are going to be on duty during the majority of our shifts. And we'll do like the mid-shift lineup. And we work very closely with the sergeants and lieutenants to make sure that we can get a wide range of lineups and trainings for those agencies.
Yeah.
I'm sorry, please forgive me. What is a lineup?
It's like a squad meeting before each shift. Officers meet and they get like their talk of the day and a heads up, and you know, they go over protocols and things like that. So it's a good time to do presentations on available mental health services, including mobile crisis teams.
Thank you.
Does Alameda have, well, one, is CIT mandatory for Alameda officers? I guess maybe that might actually vary from city to city, I'm assuming.
It
And then-
does. And so CIT, some law enforcement agencies have a goal of getting 100% of their officers trained in CIT. But that's hard because it's a week-long training, almost 40 hours. And so if you think about small jurisdictions, you are taking 1 or 2 officers out of circulation for that whole week to go through the training. And so with high turnover, you know, so the goal is for most law enforcement agencies to send officers, but I know BART has a goal of 100% of their officers, Oakland does, and a few other cities. So it should be, you know, mandatory.
Yeah, I think for South San Francisco, it is mandatory. I think 100% of the officers are
Yeah.
CIT trained. In San Francisco, we have a CIT specific team. So it's actually the same officers that we're always going out with for our MCT calls.
Mhm.
Is there like a level, like, do you start with, when you get the call, do you first start with MCT, and then if that doesn't work or if that doesn't fail, or there's, you know, some kind of whether there's like evidence of like history of violence or there's a registered weapon in the home, then it gets escalated to MET? Does it work like that? Or is it really just depending on the nature of the call and going from there?
It depends on the nature of the call and the team that's available. I know Yesenia will deep dive into this, but the reality is, you know, people call, and we all know that mental health calls can sound very benign initially and then escalate, and they can also sound very escalated and then be benign. And so it definitely depends on how the call originates, but usually law enforcement is helping us to knock on that door unless it's someone we're familiar with and nothing out of the ordinary is being reported. But most of the time, law enforcement is involved, and then we can say we're code 4, meaning we don't need you guys here. Go back out and do what you need to do, because we know John's fine. This isn't a 5150. He isn't acting out. We're going to do a safety plan and, you know, go home. So it just depends. Now, when we do get referrals for that sound like they would be better for our outreach and engagement team, like John's been on, you know, a park bench for 2 years, and today he just didn't look well. That may not be the mobile crisis call. That might be for one of our outreach and engagement teams. So it really depends on the type of call.
Okay.
Did I miss
then for your-
anything, Yesenia?
I was just going to say too, one of the things that really helps us is our triaging, right? So we have a triaging component we have a licensed clinician who actually takes the calls when the calls are coming through our office, and they do the triaging and they determine what team will go out depending on the nature of the call, the availability of the teams for that day, and where we're being requested.
Yep.
Any other questions? From anybody else in the commission?
Yeah, I do have a question. Just the cost of the program.
Mm-hmm.
Is any subsidized cost? I mean, does the police department help pay? Does the federal government come in? I mean, 'cause
So
you have
we
a lot of teams, and I'm thinking
have
that's a lot of money.
Now, I can't speak to how the individual cities operate their teams. I know like Macro, the city of Oakland put up the money for that. They got some money from the state. The CARES program, the same thing. And Mihu Hart through Hayward. But for ACBH crisis services, our mobile crisis and MET teams, our budget is a little under 8 million a year. And then for our CAT team, which is our pilot, that is averaging about 4 million a year, simply because we hired a CBO. So they pay their clinicians a little less than the county teams. But mobile crisis teams are very expensive to operate because we're like the fire department. You have to pay people to be available, and it's either the building's on fire or it isn't, right? You either have one of those days where you're like driving around the city and taking in the views, or you have a day where it's like back-to-back crisis calls. So we bill Medi-Cal. We also sometimes can bill Kaiser, because we see a lot of Kaiser clients. That doesn't always work because Kaiser's response is, we didn't approve this beforehand, right? They don't have their own mobile crisis teams. We also get grants. We also get MHSA, which, is the tax on the millionaires in the state of California. So a lot of our services are paid through that. Our pilot was an innovations grant through Mental Health Service Act. Billing, yeah. So expensive services. Our cars were expensive. We bought those through Measure A funds. So yeah, they're expensive programs to operate.
Thank
Are
you,
your
Stephanie.
cars caged?
Our cars are caged. Yeah, we have SUVs that are similar to, well, I don't know what, they're SUVs.
They're the sheriffs. The
Yeah.
sheriff's department has the same SUVs that we have, and they were fitted for our needs.
Yeah, so we have a cage, we have the seats that, keep critters from growing and bacteria, you can wash down stuff. Yeah, so we can transport for sure.
And do you guys chart in the field, or do you guys chart back at the office?
Our staff have the ability to chart in the field, but if you've you've done this work, right? So I was the type of clinician, I had to come back to a quiet environment and kind of bring my cortisol levels down before I could document. But we have a lot of technology. So we have laptops and iPads and, cell phones. And so in between calls, if you're in the car, yeah, you can document, but most of our staff come back to a desk to document.
I think Steven also has his hand up for another question.
Yeah, thanks. Sorry, something's still in my eye. So
Oh,
yeah, actually, what was I gonna say? Oh yeah, actually I have two different questions, and kind of tagging off of what Arnell had kind of asked about the costs. I'm just curious, is there something that you might have noticed that might be a little bit innovative, maybe something about some collaborative resource sharing, anything that you thought, wow, that actually was something that, to cross support each other? Because like what Krista was saying, you have some days back to back to back to back, and sometimes it's just quiet. So I'm just wondering if you've seen anything creative, innovative in terms of resource sharing.
in terms of resource sharing?
Yeah.
Okay, I do know that there are some mobile crisis teams, like some of my statewide meetings that I'm in, they utilize their clinicians to operate mobile crisis, to staff mobile crisis, but they also have another role. So they're case managers, they have a caseload. And so when they're not busy, they're focused on their caseload. We do not do that in the county because we have all these case management teams. And so I think that is a way to offset the cost. Also, Alameda's care team is operating 24/7, which is wonderful, but they're using paramedics through the fire department, and they're only they only need to reach out to the licensed clinicians if they decide to put the person on a psychiatric hold. So it built capacity. They went through a training like CIT training, those paramedics, because it's kind of beyond their scope, right? We certified them and had them go through the 5150 training. And then when they're in the field, if they need to consult, there's a clinician on call. And so I'm sure that those clinicians on call are getting paid for that time. I don't know if it's like fee for service, like they get paid for when they have to answer the phone, and then they get a different rate for when they're just waiting for the phone to ring, but that's kind of innovative. When we get a lot of questions from our board of supervisors around 24/7, and Yesenia and I are looking at each other like, I don't know how we're gonna ever get to 24/7. We can't even fill the day shifts a lot of times. But telehealth may be the way to go in terms of that. You just have to pilot it with some agency that's okay with being able to manage the call and reach out at the same time, because that, it's a different level of multitasking, and you have to have some kind of screen or smartphone. So those are the things that I'm aware of.
Yeah, and if you're interested in looking at the telehealth portion of it, Texas did that, and they spent quite a few, I think they spent about a year and a half really looking at telehealth and how they could utilize telehealth as a way of having mobile crisis capacity within their jurisdictions. And there's data out there that they collected. And so if you're interested in that particular study, I can send you the information and the contact information if you want to reach out to them and kind of explore like whether or not that would make sense for you guys. It doesn't make sense for us where we're at right now, but it might be something that might be useful for you guys to kind of look at.
Okay, and Yesenia, just make sure I heard you correctly. You said Texas, state of Texas? Okay.
Yeah, they presented at a CIT training that we went to, and so I got their information because I was curious about it as far as whether or not it would make sense, especially if you think of Alameda County, we're very vast, and we have some of our cities are so far that it can take an hour and a half in traffic for us to get to. So what they did was they had particular officers who were interested in piloting the program actually having iPads in the car. And so they would then utilize mental health clinicians to connect via iPad to do the 5150, 5555 assessment and then mental health assessment, and then provide de-escalation if available.
Thank you.
Yeah, please send that information over and I'll distribute to the commission.
Sure.
And actually, can I squeeze in one more quick question? I know I want to be mindful of time too. Hey, Stephanie, oh, excuse me, I'm getting all choked up. Earlier you mentioned about texting as a surprise. I was curious about, I was going to ask a trending question, but what was it about texting that was a surprise for you?
Yeah, so we have outreach and engagement teams that were calling people. We would get a list from our psych emergency of people who presented as psych emergency but weren't ill enough to, or needed to be admitted. But there was a crisis because they showed up in psych emergency. So we were calling those folks. We all get robocalls, right? People stop answering their phones. I very rarely answer mine if it's a blocked number or something. So we thought, why don't we text people to say, hey, we know you had a recent crisis. We're ACBH, or we wouldn't say ACBH. We would say we're from the county and we will call you soon to see how you're doing. giving people a heads up that we would be calling. We thought that people would at least respond. And it just was not successful. And so what we thought was, okay, we're calling people, they're not answering. And so we started sending those, that staff actually to do in-person outreach at Psych Emergency. So face-to-face was the best option. Phone is the second, text sucked. So text does work though, crisis support services. So the 24-hour crisis line through 988, right? They have a lot of business through text. And so that's what we were thinking too, like, you know, everybody's texting these days, but it just was not successful for us. And we were surprised by that.
Okay, thank you.
Yep.
I'm still trying to understand these two teams. So your care team, is that similar, or do they have the ability to kind of function like a warm line?
So the care team is run through the city of Alameda, and it pairs it's paramedics in the field, paramedics from the fire department, and they are the ones using telehealth to connect to a CBO. So
and then how's that different from CAT?
CAT is a clinician and an EMT riding in an EMT vehicle responding to mental health calls. So the team configuration is a little different.
Okay. And it sounds like they're roving.
Yes.
Okay. And the vehicle they have is possibly something kind of like a medical vehicle?
It's a larger SUV. So for CAT, folks have to be ambulatory. They need to be able to get out of like a Suburban. Because the goal of CAT is to do, you know, you may have someone who has like diabetes, you know, and they're having some kind of moderate mental health crisis. So that EMT is checking their blood sugar and checking to see if they need to go to the emergency department or a primary care clinic, and if they need to go to a psychiatric hospital, and they can transport. And so CAT operates citywide. It's a pilot through ACBH. The care team is operated through the city of Alameda. It's a pilot. And so we got involved because we're responsible for the entire county. We need to know what's going on in the other cities in the county, because sometime a call comes out, especially generated through 911, and we're all there. The police are there, the fire department is there, mobile team is there, the care team is there, CAT is there. And so that's the other thing I will tell you, as you roll out these different teams, of course, you can't control everything that happens, right? But get to know if you have some CBOs that are operating some teams in the field, or if the fire department or the police department, like, you guys need to have some kind of collaborative meeting, or you'll find that you're duplicating resources or services with the same group. And so we're working out an understanding with the city of Alameda that they take the lead on the folks in Alameda. Like if we get a call for Alameda, where we're trying to work out is we refer that caller to the CARES program. We say, yes, this sounds like you're having an issue. You're in the city of Alameda. Good to know that Alameda has its own program, and this is how you connect to this program. Does that make sense?
Yeah, definitely makes sense. It brings up some other questions. Your macro kind of sounded like you guys do psychological first aid, and it also brought up DEM for me. So are you guys also involved whenever, like, are you guys part of a DEM team for the disaster emergency management teams?
We have, through the county, a disaster emergency management, and crisis services is actually tapped to do a lot of that work. But macro is run through the city of Oakland. So it's confusing, right?
Got it.
And
Okay.
so, yeah, it's confusing for us. When they were talking about rolling out macro, we were like, why would you roll that out? You have so many services already that the county is providing in Oakland, but they wanted to try this pilot, and they're actually responding to calls that don't even reach the level of our mobile crisis teams. We don't need to be there. So, you know, these are chronic cases, low level quality of life issues, like John panhandling in front of the liquor store. He may not even have a mental health condition. The liquor store owner is just tired of seeing John. So they might call macro to come deal with John versus a mobile crisis team.
Got it. So I think, okay, so I had a misunderstanding then. So, because you mentioned, earlier you had mentioned community violence, right? Shootings and whatnot that happen in the neighborhood. Who responds to that? Who does those debriefings? Who like goes out into the community? If it happens at a school setting, who responds to that?
Sometimes it's the county. We have a whole a host of mental health services that are actually outstationed in schools, right? And so there was a recent shooting actually like 2 months ago at a local school in Oakland. And so someone reached out to me and I reached out to my counterpart, which is the system of care director for children and youth. And so they coordinated all the debriefings and things like that. But sometimes we're involved, sometimes the police are involved. Oakland has a whole chaplaincy program. They do some of that work. So it really depends on what happened, who called whom, and who's been asked to collaborate. Because sometimes we're working with the other agencies collaborating, or sometimes it's just us. So it depends.
So it's not necessarily that county would have a response, like that's not like the standard. It could be different, it depends.
It could be different. Yep. Sometimes, you know, we get a call from the board of supervisors, it's all hands on deck, right? We're trying to, you know, respond to that. Sometimes it is a request for example, workplace violence. We've gotten calls for that where someone has gone and shot, you know, killed their coworkers. And so they would call us and then we would kind of give them advice on what they can do. A lot of businesses don't know that they have an EAP program, right? And so we would say, well, have you contacted your EAP program first? But we've done, Yesenia and another one of our staff have done debriefings for agencies. We've provided support to schools, to hospitals. There was a recent event at John George Hospital, actually, where we provided support to some of their staff there. And so it depends on the situation and who contacts whom. So sometimes it's us, sometimes it's an individual agency that is taking care of that support.
Our contract also, Crisis Support Services, they do a lot of debriefing as well. And so oftentimes we will tap them in as well to support depending on what is going on and what the need is. So we collaborate with them as well.
Mm-hmm.
Thank you so much. I think Amy has one more.
Yeah, I'm just wondering, maybe even just from the three main ones, the MCT, the MET, and CAT, what are the different needs that each of those serve where you decided to form a new type of team rather than just add another mobile crisis team?
That's a wonderful question. And honestly, it was, when we started our 2-clinician model, like I said, it was really about supporting law enforcement. That since evolved in supporting community and providers and individuals, right? When we started MET, the Oakland Police Department reached out to us and said, hey, we want to try this new pilot, this program, to see if it's more effective than the 2-clinician model. When we started CAT, we were, I forget the name of it. It's like whole person care, AC3. Remember that? It was a pilot from that. They had a bunch of money. They wanted to do something innovative. And so we piloted CAT. And so most of the time it's like someone gets an idea, there's some grant that you can apply for, but it's something new and improved. And if I had my magic wand, it would have been give me money to expand what we already have because that model works. Although we are learning things from the subsequent models, but you could tell from this presentation is very confusing for us all. It's confusing for our staff and the community, law enforcement, EMS, the fire department. So I would love to be able to get to a point where we had one model, right? That was our primary model. And that calls that fell outside of that primary model would be given to lower acuity teams that were something else, not even called a mobile crisis team. So if you think about like the macro model, the CAT model, the mobile team model, the MET model, they exist on a continuum in terms of risk and the type of calls that we respond to. But it would be nice if there was one model And we just covered the whole county. Yeah. So there was thought about it, but it wasn't my thinking. Right? Yeah.
That makes a lot of sense. Thank you.
Mhm.
Sharon, I believe you have your hand up.
Yes, hi, thank you, Stephanie.
I don't know if that's me, but
Sharon,
I
I think
can't.
your audio is delayed.
Thank you so much. I wonder if you could just speak a little bit about the relationship between the county and the cities, because I'm hearing this at the city. Oh, you can't,
I heard a little bit
can
of
you
it.
hear
So
me?
you wanted me to speak a
No.
little bit about the county's relationship to the cities?
Okay, well, never mind, all good.
Sharon, maybe if you try turning off your video.
Yes.
If that doesn't work, you can.
You guys are, the primary funding seems to come.
Almost.
Is this any better? I'm on
A
my
little bit.
iPad, which is not very good, so I'm sorry, I'm not in my office. Just the funding, the relationship between the funding that the county provides versus the city. That's okay.
Okay. So,
I'll come back to you.
well, I'll try and answer that if I heard it correctly. So you want to know the relationship
Okay.
between the county and the cities? So this is a good question because we often have cities reaching out to us that want to create their own thing. And so they're like, do you guys need funding? And so the county is responsible for primarily ACBH Medi-Cal recipients, right? But our crisis services are open to anyone in the county. So we don't receive funds directly from any cities specifically for our mobile crisis teams. What we have is MOUs, like we have an MOU with the city of Oakland and the Oakland Police Department to operate MET. We have an MOU with the city of Hayward. It's just that, an understanding, a formal relationship, but there's no money that changes hands. They pay their officers, they take care of the car, the gas, and all of that. We pay our clinicians, we put them in a car together, and we have roles and responsibilities in our protocols. And so we do have certain cities who reach out to us and say, we want our own team and we want to pay for it. And we don't get into those kind of relationships because we are responsible for the entire county. So you have to be careful around that. I mean, I'm not saying it's impossible to do, but if you're a county entity and you're providing something to one city and not the other, then you'll be in those meetings where it's like, why are they getting everything and we aren't, right? And so we use data to determine where we deploy our teams. The cities are not supporting us in that way. We get general fund, right? We get taxpayer money, but we provide our services equally throughout the county. Hopefully that answered it because I didn't hear the whole question, but yeah.
For private insurance, do you guys get reimbursement though?
We wish. They're working on it. We get a little bit from Kaiser sometimes, but oftentimes private insurance will tell us that we're not in their approved, what is the term? Yesenia, I always forget the term. You know, when you
exactly
have,
what you're talking about.
yeah, I can't think of the word.
Exactly.
Yeah.
Yeah, we're not basically a contracted provider for them, so therefore our services are excluded. However, we do have, one of the things that we learned is that even if we're not getting reimbursable dollars, there is something about managing and having relationships with big providers that are part of our service areas. For instance, we have a partnership with Kaiser's regional services for their psych services because they have a psychiatric clinic in Oakland and they have one in Hayward and they have one in San Leandro. They have it in Union City. So oftentimes we're seeing their members. So we are able to tap into their call center and get information about their members that will help us in the field and will also help us provide continuity of care by connecting their members back to services after we resolve the crisis. Mm-hmm. So we have really spent a lot of time the last year building those relationships.
Mm-hmm.
Got it. do you guys ever go into the ERs?
You know what? We used to get called to a particular ER frequently, and we tried to designate them because, you know, the county director pretty much designates facilities and entities and individuals. And for the longest, they didn't want to be designated. So we would get called there and the police would get called there. But now we have designated every emergency department in Alameda County that can write their own 5150s or 5585s and either treat the person there or arrange for transport to an LPS designated facility. So very rarely are we going to emergency departments. When we do, it's usually the person has walked out there in the parking lot, across the street, something like that. We don't go in, but there are some counties, their mobile crisis teams respond to the emergency departments out of necessity. Yeah.
Yeah, that's ours. And I was gonna tell you that that's how we're able to bill private insurance, is because we do see them in the ER. And then that's how we get reimbursement of services.
Yeah.
Oh, okay.
Yep.
Anybody else have any other questions? Cool. Thank you so much for being here. I've been really looking forward. I know we have all been looking forward to seeing you guys. I've just on the crisis network, I've definitely heard a lot about Alameda. I think we have 2 clinicians that came from Alameda come join our team. Not that we were trying to pick your people, but yeah, they just had a lot of good things to say. And as far as we really wanted to look at your model because you guys were already doing the clinician along with the police officer, and you guys have been doing that for a really long time. And I think Berkeley also does that. It's just theirs is a little different, but really excited that you guys got to present to us and just kind of show us all the different teams and show us what you guys are doing in your county, and yeah, just give us lots of things to think about of how we're gonna try to implement some of this for our city and hopefully county in the future. So and there has to be something about the name Stephanie, because our director at San Francisco is also named Stephanie.
It's
so.
Stephanie Fellers, right?
Stephanie Felder. Yep,
Yeah.
that's my boss.
Yeah, we text each other often because we share protocols and things like that. So if you get to a point where you're trying to develop specific protocols for your mobile crisis teams, I'm more than welcome to share, and you can adopt, because you don't have to start, you don't have to reinvent the wheel. We have tons of stuff, and other counties do too. I would reach out to LA County also, for sure, because they have tons of resources and like a whole bunch of helicopters too. I think they have like 30 teams or something. So yeah.
I think their staff is like over 40 people.
Yeah, they have a lot of people. Yeah. So we're here to help. We, any service that's going to help the community throughout the state, putting clinicians, people with lived experience, working with law enforcement, getting people to the right care, we're down for the cause. So reach out anytime for questions or more detail. The PowerPoint I put together is just like basic, but we have, more information that I'm willing to share as well.
I super appreciate that. Thank you so much. We'll definitely follow up and keep in touch.
Yep. Thank you so much.
Cool. Thank you, Miss Stephanie. Thank you, Yesenia. Appreciate
Yes,
you.
Yesenia's here on her day off, so we really want to acknowledge her.
Oh,
Yeah, I'll give you the time
really?
back.
Get that overtime.
Right. We supervisors don't get overtime in Alameda County. They should, but that's another meeting. So, but thank you. Good night.
Have a good one. Thanks again for having us.
Bye-bye.
Thanks so much.
I think that was definitely long. That was probably about like an hour 15. Do you guys want to take a break? And then when we get back, we can probably maybe like discuss a little bit about the presentation. Is that what's on the agenda now? I'm sorry.
The next thing is the recess. But if you want to take a couple minutes digesting, I think that's a great idea.
Yeah, do you want to do that before the recess?
Whatever you prefer.
How does everybody feel? Anybody need a bio break or anything right now? You guys, no? All right, yeah, let's chat. I think that was super good to hear from them. I'm obviously biased about things, so I'm. Does anybody have anything to say, or like, what do they think about that? I think they're like, what are your takeaways, basically?
What? I was overwhelmed with all the teams. Yeah, it was. I was expecting to hear about one or two teams. I didn't realize there'd be so many. I mean, I jotted down all the acronyms, and then at some point I just stopped because there was just so many. I'm like, okay, if I really want to find out more, I'll go to the website. But I think Stephanie touched on it, where, ideally it would have just stemmed from that one or two core teams. But I got what she was talking about. These grants come up and it's an opportunity, and then and so that's how they've expanded. But it was definitely informative, to say the least. Yeah.
Yeah, it's definitely a lot of teams. Yeah, it's a lot. I definitely hear what she's saying when, you have one crisis services and then you just expand on that. That makes a lot more sense than let's have this team, this team, this team, this team. But again, it also seems like the county is just disbanded in a way because of the different cities. Like there's only services in this city, not this city, but it's unique in this way. I thought that was really interesting, and I don't know how that would. I feel like if something was going to go countywide, or if the county was trying to expand it, expand our pilot program right now, it would probably look something similar to that, right? Because that's already happening with the piloted program. You only have 4 cities in our county who are doing the clinician and police and law enforcement pilot. So it's interesting. Anybody else?
I wanted to share that that I'm not sure how how our services, like we're focusing on South San Francisco, yet at the county level, I see that a lot of like similar services to these teams that were presented are concentrated in South County, in San Mateo. And so, in South San Francisco, I don't really see these teams existing here for us. So in all of North County. So, that I don't know if I'm the only one that kind of has sees that, or I might just be wrong, because I don't have experience at the city or county level, or much, at the city or at the county level.
Yeah. Well, so you're not wrong. We don't. And if we do, it's my understanding that it is CBOs that have it. So I think Star Vista has a crisis team. Um, I think that it just might be for adolescents. I don't even think it's for adults. I think maybe I did hear of them starting something for a crisis team for the county, but if it's ever flourished, I'm not quite sure. But as far as I know, up here in North County, no, we really don't. I think Star Vista is the closest thing that we have to that, to some kind of crisis team. That and the piloted program that is up in South San Francisco and in Daly City. I think that's about it. I wonder if we should take a look at that a little bit more. But as far as I know, I think you're right, Sal.
If I may echo Salvador a little bit, and Arnell, there's a lot of information to absorb for me to really truly comment in any substantive direction. And partially, maybe I need a reminder, or you all can refresh me, how interesting one block, Stephanie was mentioned about how they move with the data, right? So what's our data? What are our numbers saying? Where's the areas that would maybe speak to one type of model or another? I'm just putting it a high level question because it's really a lot to make a really substantive comment on when it seems like we just barely are just discovering.
Yeah, if I can jump in there and comment a little bit. Leadership asked me to do the best practices before we do our South San Francisco data presentation, just so that you have more context, so you can ask more questions when the data comes. So that could be potentially the next meeting. We also want to hear from San Francisco Crisis Services, and then bringing Mika back to talk about, and Adam, Captain Plank, to talk about the data on our program. And I also just wanted to share, I feel like, yeah, it's a lot of information. So I'll try and like reintroduce stuff and send stuff back around, and keep going back over stuff we've already looked at to help, everyone absorb and get their arms around all the information being presented.
I appreciate that, Amy. And actually, if I may, for information, while I'm saying numbers are very important, I'm also, it's also helpful for me at least to process visually. I'm not saying text. I mean, don't packing text in front of me, it'll make my head pop. It would be really nice if there was some data visualization, some flows, connections. That would be really helpful to visualize the ecosystem that we're considering.
That's great feedback. I'll definitely share that with Captain Plank, who's attending, and the chief.
Thank you.
Any other input, comments? Nice to see you, Paula Claudine. There we go.
I was just gonna say, I have to agree with everybody, Stephen, Arnels, Salvador, that it's a lot of information to take in. And so having some visuals, that does help, but it's just a lot of information, good information, but a lot.
Yeah. If I could help in any way, just because I come from the crisis world, it does make sense that there's so many different teams, and a lot of that has to do with money, right? Like who's funding what, because there is certain amount, like they had talked about it, how MCT and MET, because all of that is county, all of that is city, then the city can do whatever they want with their money, right? Or yeah, the cities can do whatever they want with their money. And they had said that cost about $8 million. Now, when you start talking about CBOs, and I know that they had mentioned CBOs, but CBOs is a community-based organization. So these are like nonprofits. When you start adding nonprofits, that's now a different cost, right? Especially if they're going to be working with county folk or with city folk, with basically government agencies. It's all about, okay, well, who's going to pay for this person who's staffed by this nonprofit? Because either, and I think you heard Stephanie talk about it, the county or the city hasn't been able to fill that position, surprisingly. But for some reason, a county-based organization or a nonprofit was able to hire or fill that position. What else are they going to be bringing into this program? Like, so it has a lot to do with money. And then you talk about the fire department. Like who's going to pay for these services for the fire department? When you're thinking about like the city and the money and how much is going to be invested into doing a crisis services, the cheapest you're going to get, if you need something that's like, a little more, I don't want to say cheapest, but maybe cost effective, nonprofits tend to, because they don't, they don't really do like the insurance thing, the lifetime pension benefits or whatever. it's not as costly as a city or a county employee, right? Because county employees and city employees, because they have a union, and because of, you know, healthcare benefits and whatnot, are a little more expensive. Um, that's just more of a costly position or costly job to fill and to put out there. Now, when you're talking about emergency services, as far as the fire department, EMTs, paramedics, that is like the highest paid person on a crisis team, which is like even more expensive. Same thing with law enforcement, or yeah, law enforcement medics. That's very, very, very costly. So when they're talking about how for the MCT having the two clinicians, because it's county, and again, if there's something that I could like emphasize, county positions are definitely ideal when they're responding to the community at large, because one, that includes your clinicians are protected because of the unions. Number two, they hazard pay. And number three, crisis work is a lot of hard work. It is a lot of hard work. Um, and people who are in those spots need to get paid fairly for that. And I just don't think nonprofit is able to do that for the crisis work. So I don't even know if I should be saying anything like that, but so when it comes to like the different teams, it's all basically based on money and where the funding is coming from to fund those teams. That's why it's kind of confusing. I don't know, it's built that way for some reason. So I think if we're thinking about South San Francisco and them having their own teams, if we start including county dollars, it'll definitely get confusing. If this is something, we can figure something out for South San Francisco where it can make sense and it's affordable for South San Francisco to manage on their own, then we definitely have a lot more control over what we want those programs to look like. It doesn't need to be 8 or 9 different programs. It could be one program that provides all these services. Did that
Yeah,
make sense? I don't even know if I even should have said any of that, but just to
No,
kind of
no,
talk
that,
about the crisis world.
no, that, I think that does make a lot of sense. And I do want to check with the chief in the coming days to talk a little bit about that. I believe the idea is that South San Francisco would do their own program, but yeah, I want to connect with the chief and see what you have to say.
I can make a quick comment on that. I know the county is looking at grant opportunities to expand the existing program right now. We're about 1 year into the pilot program. So the data, if you guys want to start absorbing the data, it's already on our transparency portal. So if you go to ssf.net, the police transparency page, all our charts for the community wellness response team data is present there for you guys to start absorbing.
Thank you, Chief Scott Campbell. Appreciate you turning your camera on too, so we can see your face. Thank you. I think Sal, I think you had a question. I think I saw you raise your hand.
No, it was by accident. I just wanted to say that you did make sense, and you know, thank you for sharing that.
Cool. Anything else? I know it looks like you unmuted.
No, I'm just thinking, in the interest of time,
Yeah.
because we're still expecting Chief Campbell to give his presentation. So if we can maybe move to the recess, and if we do have any other questions, we could just you know, we could circle back. But I want to get Chief Campbell to out of respect of his time. So if we can move on. Yeah.
Sounds good. All right. So let's recess. I think our recess is supposed to be about 10 minutes. Do you guys mind cutting it down a little bit so we can get on with 5 minutes? Is everybody okay with 5 minutes?
Mhm.
All right. I'll see you back all at 7:35. Cool. Thank you, Amy. Awesome. All right. So we have our fearless Chief Scott Campbell here. Thank you so much for being here and putting together a presentation for us, Chief. So really appreciate you being here and being on all of our meetings. Actually, I think you're one of the non-commissioner consistent person coming to all the meetings. So really appreciate that, and just so friendly too whenever we meet in person. So all right, the floor is yours.
Thank you, Chair, Vice Chair, Commissioners. Great to see you all again, and hope everyone is having a wonderful holiday season. If I could have, as Amy, are you running my slides, or Mary Jo?
Yeah, I can run your slides.
Be awesome, thank you.
Cool. I just wanted to introduce as well, the city manager asked that the chief come and give this presentation you all based on the lockdown hoax that happened in October. You probably heard about it. There was a lockdown situation and PD responded. And so the city manager had asked to have this presentation and discussion here with this group.
All right, thank you very much. So as Amy mentioned, in October of this year, we did receive a call of an active shooter at South San Francisco High School. We are very fortunate that this turned out to be a hoax, but it also created an opportunity for discussion. So I was asked to present this evening a brief synopsis of our response that day, and hopefully be able to answer some questions that you all may have. So, the next slide, please. Instead of diving into the actual incident, I thought it'd be beneficial to talk about the history of active shooters in the United States and how law enforcement response has changed over time. So I will cover the history as well as the San Mateo County Law Enforcement Protocol, the San Mateo County Office of Education Emergency Protocol, and then we'll dive into the actual incident itself, and I'll be available for any questions. Next slide, please. Columbine High School shooting, April 20th, 1999. I'm sure we're all familiar with this case. It was pretty impactful for me. It was my first year as a police officer here in South San Francisco. And it was actually a pivotal point in law enforcement that changed the way that police respond to these types of situations. These two individuals, or animals, I should call them, were seniors at Columbine High School. They planned for over a year, collecting firearms, ammunition, and explosives. The day that they carried out their massacre, they were successful in killing 15 individuals and injuring 24 more. And the local law enforcement response was heavily criticized at that time because of the lack of immediate response. So historically, when we would respond to these types of critical incidents, patrol officers didn't have the equipment, the weaponry, or the training they needed to mitigate situations of this nature. And it was standard procedure back then for them to set up a perimeter, contain the situation, and call for the SWAT team, which would take quite some time. And obviously the delay in that could potentially result in further tragedy, further loss of life. So it was a pivotal point in the way that law enforcement now responds, as well as it opened the door to school districts looking at the safety protocols that are in place for the schools. Next slide, please. This chart represents the number of mass shootings and the number of deceased since 2014 in the United States. This is only up till July 5th of 2022. So we've had dozens of more since July 5th. The tragedy that we are aware of at a Club Q in Colorado Springs, Colorado, 5 killed, 24 injured. The Walmart in Virginia, 5 killed, 6 injured. It just goes on and on. Unfortunately, this data here, the blue circles represent the number of deceased, and the red graphs indicate the number of incidents per year. However, the criteria for this graph requires that 3 people were shot and killed. So if you look at mass shootings in general, when you remove that 3-person criteria, we've actually had over 600 mass shootings in the United States alone just this year, which is extremely unfortunate. The next slide, please. As we're all aware, these mass shootings occur at a number of places. This is a study from 2000 to 2018 of active shooter incidents. As you can see, 43.7% occur at businesses, malls, places of that nature. A staggering 20.6% happen on school grounds. 15.2% of those are on pre-K to seniors in high school. 13.4% occur in open space. 9.4% occur in government facilities. 4.3% in residences. 4% in houses of worship. 4.3% in healthcare facilities. The next slide, please. This is just some more data that covers the 20-year active shooter summary. We know that a majority of active shooters are male. This study shows that 332 out of 345 were male, and then 13 were female. There's been 1,062 civilians killed, including 29 law enforcement officers and 10 security guards, and then an additional 1,789 wounded, including 80 law enforcement officers and 6 security guards. Next slide, please. So after Columbine, as I mentioned, the tragedy in 1999, that sparked a change in law enforcement, not only in Colorado, but across the United States, and how we respond to these critical incidents. And timing is absolutely everything. The San Mateo County Police Chiefs and Sheriffs Association, in conjunction with the countywide fire chiefs, created a violent intruder protocol, which provides an integrated and comprehensive response to violent intruder and mass casualty incidents. Due to the complexity, size, and scope of these incidents, a multi-agency response can always be anticipated. Here in San Mateo County, we've established mutual aid response capabilities so that we're able to not only communicate with each of the responding agencies. A lot of counties don't have that integration where you're able to switch radio frequencies and be able to communicate. And we found that communication is usually the #1 breakdown when things don't go the right way. We've also established policy that covers a unified command. So as soon as situations like this occur, we're establishing unified command with police, fire, and emergency medical services. In addition, all the public safety chiefs in San Mateo County have a shared commitment to properly train, equip, and exercise our personnel for such an event. What does this mean? It means that we're reviewing this policy annually. We're putting all of our personnel through scenario-based training annually. And this training occurs at a number of locations. We will use schools in the summertime to stage different scenarios, empty office buildings, empty residences, anywhere that we have the ability to train and better equip our personnel to respond to these situations, then we're going to invest our time and resources to do that. Another important factor in the county agreement and the shared resources is that we all bring different things to the table as it relates to equipment. Some agencies have armored vehicles that could be used for rescuing, different types of breaching equipment, drones, protective shields, and then, of course, if necessary, at the end of it, having SWAT teams come in. And I'd also like to add that South San Francisco offers violent intruder training. It's called a so it's like a fight or fleet type protocol where we'll give scenario-based training to our biotechs. We offer it to our school district, high schools, so that we could coordinate with the teachers and students and let them know how we're going to respond and what it's going to look like if a critical incident does happen. They get the next slide, please. So in conjunction with law enforcement, the San Mateo County Office of Education also has their own protocols. This protocol was created by the San Mateo County Coalition for Safe Schools and Communities. It is basically a collaborative multi-agency group that was formed in 2013 following the fatal shooting of 26 students and staff at Sandy Hook Elementary School in Newtown, Connecticut. Another major pivotal point in how we respond and how we keep our schools safe. The mission of this coalition for safe schools and communities is to identify and address safety needs of county youth, to work across agencies to implement best practices in emergency response and mental health, and to support with a legal framework for lawful information sharing using a common language. And through this collaborative process, the coalition produced what's called the Big Five. It's a common emergency plan adopted by all San Mateo County school districts as well as law enforcement agencies. And it's basically a protocol that supports high quality training for school staff and community members and ensures clear channels of communication among schools, first responders, parents, and community members should an emergency occur. Some of these responses are pretty basic. Shelter in place, obviously, if there's a drop, cover, and hold for a earthquake, fire, hazmat type situations. The two that apply to law enforcement are the secure campus protocol and the lockdown protocol. So secure campus protocol, which will activate if we have a situation that's near a school or has a potential to go onto school property. And in that situation, students and staff are requested to go into the nearest building. They close and lock all the doors. They remain inside and continue with their learning for the day until the secure campus is lifted. The second one, the more serious one, is a lockdown barricade, and that's when we have a potential critical incident on the school campus, an immediate threat. And in that situation, students and staff are required to go inside, lock and barricade all doors, cover the windows, and turn off the lights and remain quiet and alert until they're contacted by law enforcement. To get the next slide, please. So this brings us to the actual call that we received on October 12th of 2022 at 9:48 in the morning. An unidentified male called the police department advising of an active shooter at South San Francisco High School. The shooter was reported to be on the second floor, armed with a rifle and actively trying to get into classrooms. The shooter was further described as a Hispanic male wearing a black shirt and blue pants. Due to the nature of the call, a total of 21 South San Francisco police personnel responded code 3 with licensed sirens to converge on the campus. At about 9:48 a.m., one of our school liaison officers made phone contact with school administration to let them know what was going on. And at that point, the lockdown barricade was initiated on the school pursuant to the Big Five protocol. At 9:51 a.m., the first officers arrived on scene. And at this point, there was two observations that were made that heightened our awareness and potentially brought some credibility to this call. The first being a ladder was seen placed up to a rooftop, the second floor rooftop. And the second being a total of 3 911 hang-up calls that we received from the campus. So again, not knowing what was going on, raised our awareness that this was possibly a legitimate call for service. At 9:53 a.m., a request for mutual aid response was made to neighboring agencies. As a result of that request, we received an additional 22 police officers from Pacifica, Colma, San Bruno, Daly City, and the Sheriff's Department. And we also made a request for a aerial drone, which was there within minutes so that we could have a sky view of the campus to see if we could identify any potential threats in the area. Fairly large campus, lots of buildings, lots of classrooms, football fields, etc. So a lot of ground that needed to be covered. So we have a total of 43 officers on scene. Sounds like a lot, but there's a lot happening when these types of calls come out. For example, we established a contact team. This contact team is responsible for identifying any threats and mitigating those threats as soon as possible. So they're basically a team that goes out immediately to either confront a potential shooter or search for any injured persons. Followed by that, we have search teams that get deployed. We have rescue teams that get deployed. We need to set up a containment perimeter to make sure that no one goes in or out of the area. We establish unified command posts with fire and EMS. We have traffic control issues. We have officers that are doing face-to-face liaison with the school administration, has contact with the teachers in those classrooms to make sure that they're kept informed about what's going on. We have an investigatory unit that starts looking into who made this call. Can we trace it? Is it legitimate? Any additional information that we could find. And then, of course, handling the dozens of frightened parents that did respond to the campus, not knowing what was going on, and being able to assign someone to stay with them to give them kind of play-by-play of what was occurring and ensuring them that their children were safe and that we were doing what we could to make sure that the campus was safe. Our first phase was to search the exterior of the campus, the rooftops, making sure that we didn't have any signs of any injuries, any bullet casings, anything like that. Once that was all done, the second priority was to contact each of the classrooms, making face-to-face contact to make sure that there wasn't someone in one of these classrooms holding the teachers and students at gunpoint, telling them not to communicate. So that took a while to complete that process. About 10:09, so 21 minutes into the situation, we received secondhand information that County Communications received a call of an active shooter at Woodside High School. That too was determined to be a hoax. And at the end of the day, we discovered that there was actually 6 active shooter calls made that day to high schools throughout the Greater Bay Area. All of them were confirmed to be a hoax. And we're working with our state and federal partners to try to identify this individual and hold them accountable. It's difficult because the phone calls that were made are internet-based phone calls, so it's not like they had a Verizon account or an AT&T account. They're very difficult to trace. After about an hour and 10 minutes, we were able to confirm that there was no active or present threats on the campus, and we released all the officers and turned the campus back over to the school administrators. And I definitely have to add that even though this was a hoax, it had a very traumatic effect on many students, teachers, and parents that had to experience this ordeal. And I'd like to acknowledge the fact that our chair, Crystal Cancino, who has expertise in the mental health field, as well as our clinician, Mika, both responded to the school the next day to provide their services to any individuals that wanted to seek assistance. And I know that was a big, that was important for the students and the staff, and it was received very well. So we definitely appreciate what they did. So that concludes my presentation. I'd be happy to answer any questions that anybody might have.
I have a question, Chief. If you were to grade your team's response, your department's response, what would you give your grade? What would your grade be?
Every time we have a critical incident, there's always room for improvements. We debrief every critical incident that we have of our own, and we also debrief critical incidents that happen throughout the country. It was an A+. They did a fantastic job. Believe it or not, we just had our annual active shooter response training for one of our patrol teams literally the week prior. So it was all very, very fresh in their mind. The coordination with the allied agencies that responded was fantastic. So overall, we were there. we were ready to deal with any situation that was presented to us, and everyone did fantastic.
Thank you, Chief. Just a follow-up to that, because an hour and 10 minutes passed from the moment of the call to all clear sign. I guess it just takes that long to go through each building, through each classroom.
Yeah, it takes very long. It's a systematic approach. The officers try to do it as safely as possible. Lots of classrooms, lots of ground to clear. So we don't want to rush these types of things unless the threat requires us to rush it. But yeah, it was a very slow, methodical search of the campus to make sure that there wasn't any gunmen or threats to any of the students and staff.
Thank you, Chief.
Hi, Chief, I do have a question for you. Is it usual, no, two questions. One, is it usual to have so many in the same day in high school? And two, do you think one of the goals is to see how well the response was for some future threat?
And unfortunately, these types of calls don't happen in South San Francisco too often, but they are happening with more frequency throughout the country. I know I just read an article last week. There was some in some other states. So we've had them in the past where we were able to confirm that the individual that made these calls was in another country. So it's they do it to try to get a rise. We don't think that this individual is there watching our response to see how we respond. It's something more of a just making an inconvenience to the law enforcement, creating hysteria to those that it impacts, and just looking for recognition from their friends, whether it ends up on the news or in a newspaper. They get a kick out of that, and unfortunately, it is happening more often. But and we have to balance each of these calls that we get, because we don't want to make the wrong decision. If it is legitimate and we don't respond the way that we're trained to respond, it could be pretty devastating. So we have had them in the past. The last one we had was probably a year ago, where the actual threats were made to the school district, and then the school district reported it to the police department. But this one came out, it sounded very real when it happened, and all hands were on deck, and we did what we had to do until we proved that it didn't actually happen.
Chief, I have a question about like debriefing between the police department and the school district about, you know, it really seemed, I mean, you said it early, communication is definitely one of the biggest things that always I think that always has room for improvement. And it just really seemed like, as far as on the school district side, there was like lack of communication. And would it be something that the police department, you know, when you guys went out there, what you guys have seen, how to just help this school, you know, be safe whenever there's an active shooter on site? Is there like a debriefing that goes on?
Yeah, so we had our school liaison officers and some command staff met with school administrators after this incident to talk about it. Historically, over the years, we've had pretty much annual training with the school district, with the teachers, whoever wants to attend, so that we're all on the same page. And of course, with COVID and the suspension of our school liaison program for about a 2-year period, that training never really happened. So we've already offered the training again, and we're hoping that the school district takes us up on that, because it's just a matter of when, right? And we always have to be prepared. And our goal is to be on the same page. Both of our goals is to be on the same page with each other, so that we could best provide, you know, the safety for the students that attend those schools.
Thanks, Chief. Yeah, I definitely feel like something that maybe needs to happen or hopefully can restart. Another question I had too was, you had said like mutual aid officers. We had 21 of our own officers and then 22 from the neighboring cities. Was that difficult to do? Just because I know how like some schools have different protocols, you know, for things, and I'm pretty sure you and our police department in South City have their own protocols that they understand. Was that difficult having like mutual aid there? Was there like a
Yeah, so we have all the agencies in San Mateo County have a very good working relationship. And the beauty about the law enforcement protocol is that all officers throughout the entire county are trained on the same protocol. So I could take an officer from 6 different cities, put them together and give them an assignment, and they're going to know exactly what their responsibilities are. The school district may have their own different protocols at different school districts. We go by the mutually agreed upon protocol, which is the big 5 lockdown. But there's been a lot of turnover in the schools as well, as far as like administration and teachers, and it's hard to be able to train and make sure that everyone is on the same page consistently. So I would like to, we've offered, the training, and I'd like to get back to the annual training in the summertime, so that we could really make a headway and make some effort in keeping these campuses safe. But yeah, I mean, there has been critical incidents throughout. There was the active shooter at YouTube that happened a couple of years ago in San Bruno. A lot of our personnel responded to that. Years ago, we had a student with some pipe bombs at Hillsdale High School. Mass, mutual aid response to that. So we work really well together, and we have regional training together. So when we do have these active shooter scenarios, they happen throughout the entire county, and it's different officers, different supervisors from all these different agencies working together and making sure that everyone's on the same page. So it's pretty seamless when we make the request.
just wanted to say too, I think you guys sending Mika out there like right away, pretty much like immediately. She was one of the only consistent ones. I think the county didn't even really send anybody that was like consistent. So I know that was really well received, having Mika there, her representing police department as well as mental health. So that was really, really well received.
Yeah, no, I think it was fantastic. Like I said, I thank you, because a lot of people forget, nobody was injured that day, but it was very traumatic for a lot of people not knowing what was happening. And people oftentimes don't think about those impacts and the follow-up to that. So but thank you and Mika for both spending your time to make sure that those that wanted help had someone to talk to.
Oh, for sure. Just out of curiosity, is there a debriefing that happens on your side with some officers? Just because I know maybe stuff might come up for your officers as well, and having to do that, respond to that. I mean, especially with the new officers you guys just sworn in. This was probably, like within their first year, having to respond to something like this.
Mm-hmm.
I'm assuming that there's support there too, but is there?
Absolutely. So we launched at the beginning of this year. We launched an employee officer wellness program, and we've doubled the size of our peer counseling program. We have had critical incidents where we do bring in counselors to talk with the officers and if the officers were on scene for a particular incident and it reached a certain level, then they're required to be there. And if they want to do follow up on their own privately after, then that's always made available to them. But yeah, nowadays, years ago, they think officers are made of Teflon, right? And if you say something bothered you, then you're weak, or not able to do your job. So we're past all that. We're all human, and it's important that we recognize our personnel too, that does respond to critical incidents all the time. So thanks for bringing that up.
Yeah, I do remember you guys also have an app, right? That makes it where your officers can access if they need any kind of help, and it's totally confidential. It's all one login. You don't have to create your own, so nobody really knows. So
Mhm.
yeah, you guys are definitely doing good things with that. Is there something that maybe our commission can help you guys with? I don't know what that would look like or anything like that, but I'm just wondering, besides just being mindful of, public safety and making sure that each community, is heard and seen and that they're given opportunities for healing. Is there anything that maybe we haven't seen or that you think maybe we could be supportive with?
So I was just informed last week that there's a grant that you actually don't even have to apply for. Every law enforcement agency in California is going to be getting a check for officer employee wellness sometime in the next month or two. I think it's a share of, I think it's $50 million statewide. So we're not exactly sure how much South San Francisco is going to get, but that'll be an opportunity to come up with some type of officer employee wellness plan, and whether it's bringing in counselors, whether it's doubling down on our application where officers have the avenue to reach out to someone confidentially. So yeah, hopefully I'll have more information on that in the next month or two.
Yeah, definitely let me know, Chief, and we can work together to come back to the commission and see how they could be helpful.
Sounds great.
Any other questions or comments? No. Thank you for putting that together, Chief Campbell. I know that must be difficult to kind of relive that and go through that again, but really appreciate the transparency that the department has with the community and especially our commission. So I appreciate that.
Happy to do it. Thank you.
Thank you, Chief.
All right.
I don't think we can use reactions in the webinar format. I'm like looking for the clapping emoji and I can't find it.
I think we used to be able to. That might have been taken away with the chat function, I think.
Yeah, maybe because the webinar.
Yeah, I feel like I do have to say, having Mika, again, from a crisis perspective, having Mika there and respond to the school was priceless. Because to find out that the county had sent people over, or maybe they intended to and they did, but like didn't show up for that long or couldn't stay that entire time. I think it definitely shows that the debriefing piece or the aftermath of critical incidents like that happens. It's good to have somebody like Mika in that position to provide those kind of services to the rest of the city, because that was really, really well received. And I think just having her and the teachers like and the students, that spoke volumes. And it's also a way for I think the city to assess what the school does need, just in case, because the schools are possibly focused on education most of the time. So to like really think about maybe what their faculty needs from that perspective, I think is needed. And maybe that's something that should be built into something when we start thinking about like how to expand the program, right? Like them responding to critical incidents or doing debriefings. I think we even heard from Alameda how they do those things as well. So it's just something to think about too when we're thinking about that should be like a blanket thing, just any critical incident, if it's possible.
Yeah, I'll take a note on that, Crystal.
All right. Any general comments so far where we're at? Questions? All right, it's 8:12. Amy, what's next on our agenda? I'm trying to find it.
Discussion of a potential retreat.
Okay.
Yeah, we got 3 things left on the agenda, but we can punt the complaint form if you want. The second thing is really fast. The retreat thing could be a conversation for like 10 minutes, 5-10 minutes,
Okay.
if you want to proceed with that.
Yeah, I think we definitely need to talk about the retreat just because that is coming up and there's a lot of changes that are going to be coming up in the next new year, or possible changes, I guess. So yeah, maybe that's something that we can talk about, and then yeah, can we move to that? Is that possible? Yeah.
Okay, sure. Yeah, so there's a brief staff report on it in the packet, but just to summarize, there's the idea to do a retreat with this group, which hopefully could be in person, be a good opportunity for community building. You know, people can talk with each other a little bit more, get to know each other a little bit more. So we just kind of wanted to find out what your feedback is on what you would like in a retreat. If you have any ideas about topics you would like to talk about, you know, I think we should do a mixture of like getting to know you and also like maybe strategy, things like that. So the questions that I put in the staff report, any issues you'd like to discuss, timing, what timing is good for you? Do you want to do daytime, evening, weekend? How long? You know, I'm thinking maybe 2 to 3 hours, but your feedback on how long. If you have a preference for food, let us know. And then the last question was, so with timing, initially we were thinking like January, February would be good, but as you all know, I am stepping away from South San Francisco and just continuing on with the commission until they hire a new equity person. So I'm thinking now maybe you want to wait till that new person is on board and do the retreat with them. So there's an opportunity for community building with them. So to recap the questions, and you can answer, give feedback on any issues that you'd like to discuss, time of day, length of meeting, food, and are you okay waiting for the equity officer to come on board, or do you want to do it sooner?
Well, here,
No,
Paula, you want to go?
No, go ahead, Stephen. I've been talking all day. Go ahead.
No worries. You know, from my perspective here, when I hear retreats, I'm thinking focus is strategy. I'm not sure what you mean by issues, but it should be strategic. And that should be all the focus. It really should be strategic. And in terms of how we collectively speak to that. Yeah, just to that, I think early mornings are easier. I think early mornings or mid mornings, let's put it that way. Mid mornings are more conducive. I'm not sure how extensive the thought around strategy focus might be. Usually for strategy retreats, board-like retreats. Again, I'm coming from like the business side, nonprofit side. They're at least half the events, maybe a full day of event. Again, you know, I'm fairly new to the seat, so I'm just making arcane commentaries. 2-3 hours seems like it doesn't serve very well. Might as well do it by Zoom if you're going to do that. But if you really want an in-person experience, you go immersive, full throttle, and just really focus. Yeah, it has to be a very focused session. Yeah, very structured. I mean, allowing for structured conversations, or allowing openness, but it needs to have structure. It needs to be really, really structured. Yeah. Somebody has to be a very good facilitator with that. I'm not sure. Food, whatever, whatever keeps me fueled. Food is secondary.
Thank you.
Oh,
for the
actually,
feedback.
maybe we want to support somebody local. That I'm cool with that. You know, somebody South City local. Always support local South City. There you go. Did I miss another question? Okay. Thank you.
Well, I definitely think it should be somewhere local. Support a local business here. Somewhere in Grand, maybe, just as an idea, but I think maybe like a half day would be good. Kind of like what you're saying, Amy, about 2-3 hours. And maybe it might be a good idea to wait until you transition, and I hate to see you leave because it's been a pleasure, having you on the commission. So I wish you all the best in your new endeavors. But I think we should wait until the new person takes over. And I think like a weekend morning would be great. And, focusing on strategy, but at the same time, focusing on getting to know each other since we are a team. And, I think that's really important. We haven't had a chance to really, slow down per se and really get to know each other. And that's important. As far as food, I don't know right now, but those are just some thoughts.
Thank you for that feedback.
Sure.
I definitely agree with day, maybe like half day or like 3/4 day, like starting from morning to like, I don't know, like afternoon or something. Probably the weekend, just because I think if we're gonna have it in the daytime, then like people aren't usually at work on the weekends. Definitely want to buckle down, and I mean, if we are gonna postpone this for like a little bit of maybe to like February or so, by then we should have had enough presentations as well as data to really look at this, what it would look like to expand the program. So I think that should be like a big issue that we talk about. And then any of the other issues that the council had talked about, but I feel like we've done so much work on this one already. It's probably a good time to kind of come together with something that we could present to the city council. Like, here's our recommendations. Hopefully we can get to that. And as far as food, Mediterranean.
That sounds good.
Yeah. And, yeah, I think that's good. And probably like I don't know where we're at with the subcommittees. And if it's kind of like, been on the back burner, I think that's okay. That's kind of naturally what happens anyway. But maybe we can kind of come back together if we don't have enough information or feel like we have something that we could present to the city council, at least being able to devise information between, here's like mental health recommendations, here's data recommendations. If we need more information, that's something that we can look at, I think. And I'm hoping that you'll still come to the retreat, Amy. I think it's like vital for you to be there. I'd love for you to be there. Hope that you'll be there, but understand if you can't make it.
I agree.
Does anybody else have any input?
Well, I was just gonna ask the same thing. More or less just echo what's already been said. Emphasize on strategy or collaboration, team building, especially, so that we can work, collectively to achieve goals.
Mhm.
With, I mean, it goes unsaid, we're all different personalities, so I'm looking forward to the retreat. I think a half day is at minimum, yeah, half day. If it had to go a little longer, maybe, 4 hours and a break, lunch, and then maybe another hour session. I think that would be a good starter. And then we can always revisit if you want to do another retreat down the, at a later date. And then I think waiting for the new, person, it only makes sense. And when that time comes, if you're still available, then please join us.
Yeah.
That'd be wonderful. Because you've been instrumental this entire time. So thank you, Amy. Food, well, I don't really have a preference. I like to eat, so I'm good. Anyway, and I like the idea, if we can do things locally, that's even better. Yeah, help the community out. So that's pretty much all I have to say.
I'm gonna agree with everyone supporting local businesses. I agree with waiting until the new person comes along, and I think Amy being there would actually facilitate transfer better. Let's see. I think as far as how long, we're talking about time, how much time we want to take, but we need to draft an agenda first. Maybe that'll give us some kind of idea of like framework of how much time we might need. But anyway, yeah. During the week is hard for me because I have too many jobs and I go to school, so the weekend is perfect. And that's all I have to say. Thank you.
Are we all sharing? Well, I agree with everyone, and I'm a team player, so yeah, Saturday or Sunday works for me and local. I was kind of thinking maybe Sunday around the football game, or like around that. I know the 49ers right now we just lost their quarterback, so we went from Super Bowl contenders to, I don't know what's gonna, uncertainty now. No, I'm just joking. Yeah, I hope we can all get together and build. I look forward to it.
Cool. Thank you all for all that feedback. That's really helpful. I'm glad people are open to meeting on the weekend and taking one of your mornings to do that. And I'm also hearing it'd be helpful for me to come, so I will plan to do that. I will say, I took a position in the city of Oakland and I've started there, but I'm continuing to staff this commission just because I care about you all and the work that you're doing. And I really want to do everything I can to help you be successful. So I'm staying on just for you all. So definitely taking that note.
A quick question. I know we're looking at wrapping up tonight. Just quick question. Help remind me, or maybe you all already know. Are we anticipating by the time at the top of the year, whenever the retreat's going to occur, the look of this board changing, seat wise, people wise? By in terms of service time, expiration terms, stuff like that. Does it make sense? No? Yes, no? I'm just curious.
Yeah. So the structure of the commission doesn't change. There is a weird thing where some of the commissioners were appointed by council members. and their terms technically end this month. But all the council members were reelected that were up for reelection, so I assume it's going to be the same commissioners, but the city clerk is still working on that. Paula Claudian's been asking about that. So none of that stuff should really change. One thing that does change, and it's the next item on the agenda too, is in the ordinance creating the commission, the chair and the vice chair are elected at the first meeting and then the first meeting of every year. So the first meeting in January, I think there needs to be an election for the chair and the vice chair. The current chair and vice chair have only served since June because the commission's only been meeting since then. But I think in January, there needs to be an election, and then after that, it'll be every year. You guys do have the option to re-elect the current chair and vice chair, which could be helpful, and it hasn't been a year term, you know, could help continue things, but that's really up to you all. So the structure stuff isn't expected to change a lot, but there will be that election for chair and vice chair.
Regarding the next meeting, looking ahead, I noticed it fell on Martin Luther King Day. So it would seem I would think we would change the meeting, but you know, any one of you can correct me if I'm wrong in my presumption. I just want to kind of throw that out there that it's our next scheduled meeting falls on Martin Luther King Day.
Yeah,
That's-
you're right.
That's really great. I'm glad that you realized that, Arnell. I hadn't looked forward. I have to check the ordinance. I think sometimes some of these ordinances say like it can fall on the next calendar day, which would be Tuesday. I suppose if you all didn't want to do that, we could look into doing another special meeting instead.
Well, on that note, I'm not sure we're carrying the theme. It just took a peek into February, President's Day. With third Mondays? Are we on third Mondays?
Yeah.
So
It's
that's
also-
President's Day
oh
in
my gosh.
February. So
Okay.
it's somewhere in between.
Wow.
Yeah, I guess Amy, if you can check, you said ordinance. What would be the, you know, procedure or protocol, you know, if the regular board meeting fell on holiday, you know, could we just have it the following day, like Tuesday, I presume? I'm hoping that's okay with everyone else. I think that would be okay with me. I'm pretty sure it would be. But if there's already a established protocol, then we should follow it. Otherwise, I guess we can vote on what we'd want to do. But I'm kind of not leaning towards another special meeting because I kind of felt like we lost a lot of time with this one, canceling one meeting, and I just felt like we just lost time, and I don't necessarily want to do that again.
So if
Is
that's what the
anything-
ordinance says, are you all comfortable with doing the meetings on Tuesday instead? January and February? Yeah. Anyone not comfortable with that? Okay. Send me a message too if you think of something later.
Let's
Yeah,
look at the date. That's the 17th then of January, right? A Tuesday, same time, 6 o'clock.
sure, yeah. I'll double check the ordinance to make sure I have that right, and I'll circle back and communicate.
Can we have a backup plan just so since we're all here? Would that be maybe the second or the fourth Monday? Or are people open to that as a backup plan? Maybe the second Monday? I think that's the 9th, is that right? Steven, are you shaking your head or are you looking at something? Wasn't sure. I see you doing this, I'm not too sure.
Sorry.
Second Monday is the 9th,
9th, okay.
January.
So if not the 17th, then the 9th. Is everybody okay with that? Cool. Thanks, Steve.
Yes.
All right, cool. Hopefully that's helpful, Amy, so you don't have to like come back and ask which day works again. So
That's
it's not the
great.
17th and the 9th.
Thank you.
Yeah. Should we do February as well? Should we do that that Monday before the holiday? Before President's? I think it's the 13th, Valentine's Day before Valentine's Day. Just in case people are on a
Oh,
trip
you-
for Valentine's Day
marital
weekend.
bliss, oh boy.
Yeah.
Um,
Should we do the third Monday then, maybe?
Maybe the Monday after for that particular month.
7th?
For that one. Yeah. Looks like it's either the 13th or the 27th.
27th.
27th, fourth,
That's
fourth
my
Monday.
opinion.
27th, I'm okay with that.
Yeah. I like your opinion, Paula Gladys.
Thank you.
Sal, are you good with that? Cool. Carol, you're good with that? Mary Jo, I'm assuming you're good with that?
This is fine, but just wanted to remind the commission, my priority in choosing the date, staff can just attend which date you pick.
Okay, cool. Thanks, Mary Jo. All right, cool. Thanks, you guys. All right. Anything else from staff? Amy?
The only other thing, this was Mary Jo, maybe you want to speak up about the Form 700 and the ethics training.
So I believe by last week, our city clerk has started emailing all of you about Form 700, which is a form, I believe, for conflict of interest in terms of like monetary incentives or any like monetary dealings. And there's also a link to ethics training. It should be, I don't believe there was a deadline that she put on the email. I can reach out to her if there's no deadline listed, so please let me know. But I do believe she said it's mandatory to be completed. So if you have any questions, please let us know and we can reach out and get those answers for you.
Those links are an email if we haven't done them already.
I do believe it was sent to your emails. I think it should have been sent to you all individually. They did start sending it out last Friday, so perhaps you may not have received it yet. So this can also just be a heads up.
Anything else?
I just want to clarify that the date for the January meeting was that January 9th, you said? Okay,
Well, probably the 17th, if not the 17th, the 9th.
Yeah, that's right. If not the 17th, the 9th. If not that, the Tuesday after the holiday, then the 9th.
okay.
All right. Next we have, so the complaint form, maybe we should, I know that we've pushed this off so many times, but maybe we should just do, this should be something that's on the agenda at the retreat. Are you okay with that?
I didn't hear.
Because I think we're gonna keep pushing it off until yeah. I'm sorry, Paula Claudine.
I didn't hear you clearly. Can you repeat that again?
Yeah, I was saying the complaint form, we've had that on the agenda a couple times now. It's
Okay.
but we keep pushing it back into the parking lot. So I think if we just make a decision and say, let's just look over this at the retreat. That might be better instead of constantly putting it on the next meeting, not having time for it, and then we just keep pushing it back onto the parking lot. I think we'll just put that on the agenda at the staff retreat.
Good idea.
Yeah.
Mhm.
Any objections to that?
No, I have none.
All right, so I think that brings us to future agenda suggestions. Does anybody have any other suggestions that that they want to put on future agendas? Something you guys can think about that would be helpful for the commission. No,
Yeah.
not yet.
I think that's a standing item too on each agenda. So if you ever crosses your mind during the month, oh, it'd be good to talk
Mhm.
about such and such, that's one opportunity to bring it forward. You can also share with the chair and staff, but it's a placeholder. So if you want, if you come up with something over the course of the month, feel free to bring it up at that time.
Okay.
Items from commission and staff. Any items from commissioners?
I have this, I'm not sure if it's relevant or, when we talk about items from commission, are they to just pertain to equity and safety topic, or what are the things that we introduce on that agenda item?
I think you can share whatever, if there's something coming up. I know city staff will tend to share like upcoming city events, but
Okay.
feel free to share anything you'd like.
Well, I don't know if I mentioned in the beginning when I was introducing, when we were talking about ourselves, but my husband and I have a band called Love Struck, and we're playing at a local venue over at Fort McKinley. I don't know if you guys know where that is. Okay, so it's going to be December 17th, which is a Saturday night at 8 p.m. And it's free entrance, and it's going to be a lot of fun. So I'd like to invite you guys to come down and have a little fun, listen to some music for the holidays. Yeah, we play everything that's danceable, R&B, Latin, pop, you name it. So it's going to be a good time.
Thank you, Paula.
Yeah,
What time is that?
starts at 8 p.m. 8 p.m. at Fort McKinley,
December 17th.
December 17th, the Saturday night. We start off with rock, and then we go into like an R&B, Latin, pop. So there's something for everybody.
Thank you.
Thank you for the invite. Do you need a cowbell person? I'm pretty good at that.
Yeah, make sure and bring the cowbell. And if you come, please let me know that you're there.
Yeah, I'll definitely swing by. I think that'll be fun.
That'd be great.
Yeah. Cool. Anything else from other commissioners? Things that you're into, shows that might be helpful, anything general? No? Items from staff?
I think I jumped the gun there. I thought we were there before. So it was only the Form 700 thing.
Oh yeah, that's right. Yeah, no worries. Cool. All right. I think that might be it then. I know next month, I know my team is gonna be presenting. Is that right? We have that on the agenda. I'm not going to be speaking because I'm wearing a different hat in the commission, so I won't be speaking as much as I was speaking today. So cool. All right, yeah, I think that might be it then. If nobody has anything else, I think we could say good night.
Actually, can I just ask a logistical question? How long are these meetings supposed to be scheduled for?
That's a great question, Steve.
Yeah,
We're still trying to figure that out.
Okay, yeah.
Mhm.
I'm just, because I'm saying, am I scheduling? All right, so I just, because I logistically, it's tricky for me when we stretch when so yeah. Because I have to drive. I have to drive back home. Yeah,
Oh, yeah.
Yeah.
I think typically it's been about 2 to 2.5 hours. We've played
Okay.
around with the agenda so many times with like having 3 presentations, having 1 presentation, having like 5 things on the agenda. And I'll be honest, it's like even though we change however many items are on the agenda, it always seems to last about 2 hours to 2.5.
Okay,
Yeah, that's just what I've noticed. This is definitely one of our longer meetings. Besides, I think the first meeting was almost 3 hours. I think the first meeting was, but I think at the same time everybody was just getting to know each other, and we had a lot of people on that meeting. But yeah, am I wrong in saying that, Amy, Arnell, Mary Jo? It just seems like no matter how many times we shorten the agenda, it's always about 2 hours, if not a little more than 2 hours.
It's like 2.5 usually.
Yeah.
okay. Yeah, I
Maybe
thought it was 2
try.
hours, and I would just be more mindful of that. Yeah. Yeah, I just want to make sure, yeah, I want to be here for the duration. I just want to make sure there's a common understanding that I'm on the same page with. Yeah.
If anybody has any ideas on how to make it shorter,
Maybe we'll
Other
figure that
routes.
out as we hit into the new year.
yeah,
That could be our resolution.
Yeah.
Keep
yeah,
it under 2 hours.
keep it under 2.
It-
Yeah.
Yeah, it can be done. Yeah, I remember when we were in the Cultural Arts Commission. Remember, Crystal, they used to be long meetings,
That was
but
like
then
40
it ended up, getting shorter, and we're still accomplishing a lot.
Still complicated. Yeah, I think it's because of the presentations, the trainings. Like we just have a lot of stuff
Yeah.
to cover. But yeah, and yeah, it's true, Paula. I remember one time we had a
Yeah.
meeting that was like 35 minutes. And I was like, oh,
And-
thank God I wasn't late.
Yeah, so like they say, it's not necessarily the quantity, but the quality.
Yeah.
Yeah.
Yeah, I guess that's true. Yeah.
We'll get there.
Yeah, we'll get there. All right, you guys. Well, then I think with that we can adjourn.
Yeah, wish you
Yes,
guys
I'm motion
happy
to adjourn.
holidays.
Yeah.